Well, the top 3 insulin producers are now slashing their prices following years of pressure from advocates and more recently the Biden administration. French company Sanofi is the latest to say it'll cap insulin costs at $35 a month for people with private insurance. It joins Eli Lilly and Dutch company Novo Nordisk in capping monthly costs at $35. I talked to a health policy expert and advisor to the president about the impact.
Insulin is a life-saving medication that costs just $10 a vial to make, and yet we've seen years of drug companies hiking their prices and making this medication unaffordable for folks. As a result, we hear horror stories about people rationing this drug, borrowing from family members, making impossible choices between putting food on the table and getting the medications they need to stay alive. It's an entirely unacceptable situation. It's why the president has been working so hard to lower drug costs across the board, and why we are really pleased to see the private sector responding to the president's call to action and lowering their costs.
According to the American Diabetes Association, more than 37 million Americans have diabetes. In Iowa, that number exceeds 242,000, or nearly 10% of adults. And it's estimated 70,000 more have it but have not been diagnosed. In Nebraska, more than 141,000 people have been diagnosed. That's 9.6% of adults, with about 44,000 more living unknowingly with diabetes. And then the financial costs. The association estimated it's $2.6 billion each year in Iowa, and in Nebraska, $1.4 billion. It's important to treat diabetes since it can lead to heart disease, stroke, amputation, blindness, kidney disease, and death.